Welcome to Module 6. Let's go over the key concepts for this week and keep these concepts in mind as you are working through the module. The question that I have for you is, what happens when someone doesn't fit into one clear category and systems do not know how to respond to that complexity? Does it happen? Absolutely. Sit with it and think about it. Now, some of the core concepts that I wanted you to pay attention when you're doing your readings are mixed identities and belonging, immigration and historical exclusion, disability and multiple identity, trauma, which is PTSD, post-traumatic stress disorder and behavior, systems and structural barriers, disability in systems including incarceration, and vulnerability and harm. Now, we start by exploring mixed race identity and how society often pressure people into choosing one categories. Unfortunately, systems are built around clear definitions, but people aren't always cut clear. This creates tension, exclusion, and sometimes identity conflict. This reminds us that systems have always played a role in deciding who belongs or who doesn't. The module also focuses on disability, not as a single identity, but as something that intersects with many other experiences. Layer and top a layer and top a layer and top a layer. So it's layered, guys. Think about it. It's not only one. For example, someone with a disability who's also an immigrant or part of a racial minority may face layered barriers because it's not just one identity that decides, multiple, right? All right. We also examine trauma, particularly PTSD in veterans. This highlights that not all challenges are visible and that behavior often reflect deeper experiences. Here we look at how systems respond to disability in areas like incarceration, where individuals are often punished rather than supported, unfortunately. And finally, we explore how disability can intersect with violence and hate crime, showing that some identities increase vulnerabilities for sure. Overall, this module helps us understand that people's experience are shaped by multiple systems at once, and that complexity matters in social work practice. We have to pay attention to it so we can we can recognize those barriers, learn how to navigate them, and then teach our clients to move forward with it. Some of the examples that we come across in social work practice, a mixed race patient may feel that they don't belong in one category. They identify differently, right? And it is not the norm. What's our role in such situation is to create a safe space for them, to document how they would like to be identified, right? To carry on that story with them, to help them express it safely. Okay, a veteran who shows irritability and avoids engagement. Most of my veterans at the VA preferred phone appointments versus office visits, and it was honored. Absolutely, it's their safe space. But how do we address their symptoms? How do we address their needs? By creating a trauma-informed environment. Do we always have the means to create that? Absolutely. Sometimes not. So we look into creative way to address those needs. Now, a patient that misses care because of transportation, care isn't available anymore. If they miss their appointments, couple of appointments, they're kicked out of the system. Once we became aware, we advocate to fix it. We make exceptions. We accommodate to needs. Now, understanding people means understanding the full context of their experiences, not just what we see on the surface. Understanding systems help us support the client more effectively. As I've mentioned, it allows us to see barriers and how we can address them. Now, while we are helping the clients building the skills and the confidence to navigate those systems, we don't take away their personal responsibility that they're carrying to move forward in their lives. So we bridge the gap. We support awareness, we build capacity, and we walk alongside of them to navigate such system. All right, thank you.